And then I'm going to share my screen. Okay. It tells me, let everybody know they're being recorded and transcribed. Okay, let me share my screen here and then we will get started. All right. Hello, everybody. Thanks for joining us today. We are going to be talking about Benefits 24/7. We're going to walk through kind of the main functionality for everybody in this group. I don't think there's anybody that's here today that this is really going to look super unfamiliar. Most of you, if not all of you, have been in or use My Account on a regular basis. So Benefits 24/7 should look pretty similar and pretty familiar to you. I want to really highlight today what is different in Benefits 24/7, and then we'll start walking through some of the functionality and looking at what it looks like to go through adding subscribers, newly eligible, some of those kind of routine things that maybe we don't need to do on a daily basis, but our benefit admins will be doing so that we can make sure that we're helping them. So before we jump in, does anybody have anything right out of the gate that they want to ask a question about or bring up before we dive in? I'm happy to facilitate that before we get started.
This is a, oh, go ahead.
No, go ahead, Amy.
I just wondered if staff were going to actually get to be in it while you're demonstrating.
So great question. The purpose or the goal with this training is, I mean, I'm going to be showing what some of the functionality is. Folks are welcome to ask questions along the way. There is no expectation that people need to be following along and doing it as I'm doing it. However, you're welcome to. I just want to acknowledge that if we're running into issues or things of that nature, you know, please address them with us and put them into the chat and we can try and help, but we're not going to be actively troubleshooting as part of this training. So you're welcome to be in and following along if you'd like, but there is no expectation that you need to be.
Okay, I had a question. This presentation that we're viewing, is that going to be linked anywhere on the website for us to be able to refer to?
Yep, so this is being recorded and it will be available to be seen after today. So we'll get that posted. I don't have the specifics of where, but I would imagine it's on the SharePoint site where other things that have been posted, like the various meetings and such that have occurred. So Christy Snow will facilitate getting that posted.
Okay, thank you.
Yeah, I think we usually provide a link via YouTube.
Yeah.
So that'll be,
yep.
But it does take a few days for it to become available because it has to kind of go through a process.
Thank you.
Anything else before we jump in? Okay.
Hey, Amanda, I have a quick question.
Yep.
Could you increase your picture a little bit?
Increase my picture.
Yeah, your screen, if you could.
Okay. I'm guessing like zooming. Is that what you're asking?
Yeah.
Okay.
And is this going to be the original? Yeah. Is this going to be the original color that's coming out? Because I know it's a training. No.
No. So this is just the training environment, and with Benefits 24/7, our different environments have different color schemes that it helps us on the project team keep track of where we're doing things. But the actual production environment will not be purple.
Okay.
It'll be white with blues and greens, like we're similar looking and feeling to My Account.
Okay, great. Thank you.
Yeah. All right. Anything else? All right, I'm going to turn my camera off so my face is not distracting to you all. I don't know if you're actually seeing me, but I am going to do that. Okay. So I'm I want to take a moment here to just kind of acknowledge this login page because it is a little bit different from SEB My Account. And the reason for that is because obviously, as we know, all of our PEB and SEB members are going to be in benefits 24/7. So all of us as state employees are part of what's called the active directory. And what that means is just like for you folks who log into SEB My Account, you know that you can use the bottom green button as the HCA user and you hit login and it takes you directly into SEB My Account. You don't have to use SAW. And because of OCIO requirements, which is a state agency that oversees a lot of our security things throughout the state, they do require that anybody who is in the state government network that has Active Directory to be able to use various applications through Active Directory. So we have that ability for state agency benefit administrators to be able to log in through the Active Directory. And so while our language in benefits 24/7 right now is not 100% perfect, it will be by the time we go to production and when this thing launches. But I wanted to bring this up because basically the top login option here for employees, subscribers, external admins, this is really the SAW login option. So when all of us go in to manage our own benefits in benefits 24/7, not as a HCA staff member assisting other people, but logging in to manage our own benefits, we will use this top login option, log in through our SAW account, and that's how a lot of our employer groups who are not part of state agencies or SEB organizations that their benefits administrators are already using SAW, they will use the top login button. And so I want to make sure that that's very clear for all of us as we are assisting benefit admins to understand that anybody who is not part of the state will use this top login option. And benefit admins who are part of the state network, so somebody who works at Fish and Wildlife or somebody who works at Department of Ecology, those folks will be able to use the bottom login option and go through that Active Directory, and it will take them to their benefit admin access. And then all of us as HCA staff members who assist other people also using this bottom login button. So I know it's kind of silly to take a little bit of time to talk about the login page, but I wanted to make sure that that was clear. And of course, we'll have all of that in documentation as well, but wanted to make sure that that distinction was clear.
Hey,
All right.
Amanda.
Yep.
I'm not sure how familiar you are with our HCA support ticket thing, but it sounds like this is going to work the same way as that. When people click on to go submit a ticket, it asks them, hey, are you an agency person or are you a non-agency person? And one either puts them directly in and the other one takes them through SAW. It sounds like it's the same concept here.
Same concept.
Okay.
Yeah.
Okay. All right. Thanks.
No problem.
I had a question too. This is Carla. I've seen where benefits administrators that have access will do things for their own family, but they do it with their benefits administrator access. Will the system be smart enough to know if they're trying to add their own personal things as a BA rather than logging in?
We see that in, an audit report or looking at the history, right, of an account that we could see that they've done it as their admin versus as themselves. There's no way for us to stop that from happening. It is and it should continue to be very encouraged that benefit admins, if they're managing their own benefits for their personal self, should log in through their own personal access. but we don't have a way within the system to, you know, block them from doing anything on their own account.
Okay, thank you.
All right.
I was just going to add to that. We don't want to in a lot of cases because in some smaller districts, they really are the only benefit administrator.
Yeah.
So there are occasions where, yes, they are approving their own dependent verification. All of those actions are auditable. And so certainly they would have to stand behind the choices that they made and any actions that they took within the system. And we would be able to track any actions taken in the system by who made that change. So 100% what Amanda said. And in addition, we couldn't lock it down because it would hinder somebody's ability to actually complete enrollments in cases.
Thank you for that additional. Appreciate it. All right, so I am now on the dashboard. Again, I'm logged in as myself as an HCA staff member. So for all of you who have been into Seb My Account, really, this looks very familiar. There is a couple things that I'm going to point out that are a little bit different. But for the most part, it's very familiar. So we have manage subscribers, manage access, getting access for benefit admins, managing organizations, dependent verification, special enrollment event verification, reports. We have a self-pay dashboard, which we'll talk about, application settings, error handling, and then the subscriber enrollment history. So not every person that has access to benefits 24/7, not all of us will have access to each one of these pages. There are a couple of pages within benefits 24/7 that are restricted to certain individuals with access. Error handling, this is more for a limited number of people who will have the ability to help resolve issues with records going into pay one. So not everybody will, you'll still be able to see it, but you won't have access to that page. And then application settings as well. Those are more for managing open enrollment, messaging in the system. So those aren't things that we're going to spend time during training talking about. Subscriber enrollment history, we will spend some time going through that throughout this training. So I'm not going to touch on that right in this moment. But for those of you who are familiar with the SEB audit report, it is also known as the benefits reporting tool. The appeals report, however you may refer to it as if you've seen it. Basically, you can look up any subscriber or any dependent and get to a subscriber account and see the history of changes that have been made on the account, who's done them. And so instead of having a standalone website like we do for SEB right now, it is built into benefits 24/7, and it is going to be available for benefit admins as well. So I know that's been a lot of phone calls, a lot of fuse messages that we've seen throughout the years since SEB has started of we don't know what happened, we don't know who did this, who did that. Now it is going to be available for benefit admins to see. So as we add people throughout the training, we'll look at that history and really examine it a bit further. Another thing I want to point out that specifically our O&T customer service folks are probably wondering, there is no account corrections tile. There is no account corrections option in the navigation bar, and you would be correct. There is no account corrections. So we have worked through handling that in a different manner in benefits 24/7. So there's ways to fix records, there's ways to fix enrollments, and we will be working through those. But that is one probably significant change to most of you that you're used to using in Seb My Account that is not available on Benefits 24/7. Not to say that we don't have ways to look at things. I just wanted to point it out that that's one of the big changes in Benefits 24/7. So again, dashboard, really familiar, very much operates the same way as Seb My Account. So I'm gonna,
Hey, Amanda.
Yep.
Sorry, that self-pay dashboard, I'm assuming that's going to be just for HCA staff and BAs won't see that.
That is correct. So
Okay.
my dashboard that we're looking at all together, this is as an HCA staff member. So a benefit admin dashboard does look a little bit different. And I was just about to go into one here in a moment.
Okay.
The self-pay dashboard, you are correct. That is just specifically for HCA staff. And mostly our partners in customer service, PCS, are the ones that will be utilizing that. And so I was planning on touching on that with this group kind of towards the very end, not spending a bunch of time on it, but just walking folks through what it looks like.
Sounds good.
All right. So with the manage organizations, it is very similar to, and I apologize, I am going to be referencing a lot how things are alike or different with Seb My Account because I just know you guys are very familiar with that. So I want to keep highlighting that, and I know it's going to be probably kind of annoying, but so manage organizations, when we come to this page, you're going to see every PEB and SEB organization right when you come to the page. Now, you can search for any organization that you're looking for. You can, before you search, maybe let's say you only want to see a SEB organization. What's something that is in both? Know that one. So we have this school district. If I only search for SEB, I will only get the option for the school district. If I unselect show only SEB and hit search, now I'm going to get every option with that name for both SEB and PEB. And the same would be true if I hit show only PEB, then I'm not going to see the school district show up in my search. So because there is so many organizations, once we add in PEB and SEB together, we included this filtering option essentially to make it easier, faster to get to where you're looking for. So there's that. And then the other thing in all of our tables, anything where you see, I think this looks like one of those light bulbs that like a can light bulb, but it's a filter. So anytime you see one of these in a table, you can also select that little filter, and then you can search. And so if I searched, let's just say SEB, I'm only going to get options that are an organization type of SEB. So kind of silly to highlight there, but with so many organizations, we wanted to make it as simple as possible to get to where you're looking for. So let's pull up an organization. And I'm going to stick with the easy for right now. I'm going to select the healthcare authority. And when I select manage organization, so now this is what it looks like on the benefits administrators dashboard. So if I actually logged in as Amanda Neville, benefits administrator for HCA, this is what my dashboard would look like. Manage subscribers, manage access, org profile, dependent verification, special enrollment verification, reports, the data depot, and then that subscriber enrollment history that I talked about. So this is what our benefit admins will see. Again, very, very familiar to My Account. Same options up along the top here. Any questions about this?
Hey, I think I'll just mention you're looking at a tab right now, and so
I am.
the SEB ones will have a billing billing
true.
file, and the PEB
Yep.
ones will not. Correct.
Yep. Correct.
Okay, and both will have a data depot. It looks like.
Yep. Yep.
Okay.
So the data depot will be for PEB and SEB organizations. And let's just go ahead and pull up a SEB organization here and highlight what Jeff mentioned. We now see that billing file, and there's also the eligibility file option. So our SEB organizations have the ability to do a mass uploading of newly eligible folks. They've had that ability in My Account from the very beginning. So we retained that ability for them to do the eligibility files. We do know about 7 or 8 districts are regular users of that. But since those about 5 out of those 7 or 8 are very frequent users of the eligibility file, we wanted to maintain that ability for them. So this is a SEB organization dashboard. And again, the one difference is that subscriber enrollment history for a SEB organization. So I was going to jump in and just walk through adding a new subscriber. I do want to approach it from the PEB perspective first. So I'm going to come back and grab a PEB organization. Anybody have a PEB org they want me to go into and add a new person? Take suggestions. Make it interactive.
Commerce?
Commerce?
Yes.
Do it. Okay. So we're going to go to manage subscriber, add new subscriber. We are going to enter in our social security number, and we'll do a date of eligibility. Our person will be eligible as of today. And let's go ahead and this is the hardest part, is coming up with names. Really creative here. So as a reminder, any field that has an asterisk is a required field, should feel familiar. We have our eligibility reasons here. So this person is going to just be a newly eligible member. You can see here highlighting a difference from what we know in My Account. Once we've started the process of adding somebody with a social security number and a date of eligibility, and we come to this page, if our benefit admins or us notice that the SSN or the date of eligibility is incorrect, you see that we cannot change it here. So the way that we do need to change it is we would just go ahead and hit cancel and we would start over. So kind of prevents people from changing. Really, it's the date of eligibility before saving it or something with the incorrect date. We want to try and help them catch it up front. So you can also see, this is something that I know would make me a little bit crazy in My Account, is we display again, uneditable field, but we do show what the coverage effective date is based on that date of eligibility. So that is highlighting a new feature in Benefits 24/7. We have the represented field, and when we select yes, we have an effective start date. So that will be a required field once we select yes. Employee eligible for LTD. So this option is available to change to a no. And really where this would be highlighted, where we'd want to select a no is our seasonal employees are not eligible for LTD. So anybody who's not eligible, so seasonal and port commissioners. Yeah. So they would, we would make sure that that option would be no. As we talk about SEB, locally eligible, which that is a change, and we'll talk about that in a little bit, that we would also select, that option would be no if we select them as locally eligible. So
Amanda, question?
yes.
What about our groups that are medical only? Will they even see that option?
Jeff, do you know the answer to that off the top of your head? If we see the LTD? Yeah, if they're a medical only group, do they see that option?
2 minutes.
Yeah, we will check on that and get back to you, Amy. I just don't know off the top of my head.
I just don't, even if it's grayed out so that they can't select, because we've bumped into problems even in pay one where they get enrolled in dental instead of waiving it when they're medical only. So I just want to be sure that we're not causing our own problems.
Yes, that's a really wonderful point. Thank you. Also for PEB, the salary field is required. So it is not required on our SEB employee or SEB subscriber records, but it is for PEB because we know that we need that for LTD. And then we have the hire date. And then address. So if they do not have a separate mailing address, we just need to select the checkbox here, and then it will it won't require you to add a separate mailing address. But of course, if we have one, we'll want to go ahead and enter that as well. Extra digit there. All right. And then once I am done,
hey, can I catch
check
you before
everything?
you
Yep.
submit? This may be a question for Jeff. I know I've asked him about this. Do we know what on this? So this is commerce, which probably is coming over from HRMS. Do we know what data will be filled in already before the BA gets to this versus once they've added the social security number and date of eligibility? Like I'm assuming, well, I guess I don't know, the represented, the LTD, is any of that coming over from HRMS?
Yeah, and I still do owe you that. Guess what?
Okay.
I'll work on that right now, and I'll say, here are the list of things that you will see on these screens that will be pre-populated based on HRMS information, and then when you're adding, you will have to provide this for us.
I believe it gives you the subscriber claim message, right? Or something of that nature when it's a HRMS person that's come over on the Gap 9.
Yep, we recognize them, and then it asks if you want to claim them. You have to give us the eligibility date, obviously, before you get to that point. But then you come here, and like you saw, I think when we went over this, Jeff, you will have to give us the eligibility reason and some certain information. But most of that we do pull. So I'll go ahead and work on that, and I'll get that to you as soon as I can.
Right. I think the bottom line is there will be some information here, but the BA will still get directed to it, and they'll still need to look for the fields that are required that don't have any data in it, right? I mean, that's the bottom line.
So basically with the HRMS, we get the data in, and if I can make an analogy, it's kind of like in a holding cell, right?
Right.
And so they're in the holding cell until the benefits administrator actually goes in and goes through that first page of entering their social and the date of eligibility, because now we're saying, hey, this person's also eligible for benefits. Then Benefits 24/7 says, hey, we found that person in the holding cell. Here's the information we have. Fill in the remainder and then submit it.
Okay, thanks.
Yeah.
I'd like to ask a question.
Of course.
Okay, so is the training environment, is it possible to bring some of those entries over from some kind of test or something from HRMS? I've been working in this, so because I'm going to be training BAs, And it's a big question I've had, like what comes over, what doesn't. And I know Jeff just said that he's going to send that to Jeff Dixon Ross. But for me, I guess I would like to see something be populated into the training environment from HRMS and also from the higher ed CTC application, so that when I'm demonstrating this to these BAs from these employer types, that I can actually show them what that's going to look like, because right now I have no idea what it's going to look like.
Okay, we can definitely take that down and work with you guys to see what we can do. I know we have limited capacities for doing some of those things. I think we talked about we don't have all of our connections hooked up to the training environment. And what I mean by that is like there's a lot of nightly jobs and things that Benefits 24/7 will do. And we don't necessarily have all of those connections into the training environment, but we can talk as a project and see if we're able to help get some of that data into the system for you guys before you do training.
And the other piece too is, yeah, we don't put production data into a training environment. So we wouldn't really want to put down we wouldn't want to actually hook up the HRMS data feed to this environment. So we do test that with mock data in our test environment and our UAT environment. So yeah, we can, as Amanda said perfectly, we can definitely take that back and consider what that looks like, or at least provide screenshots of, in this instance, here's what it looks like.
Thank you.
Jeff Grebner, can you copy me on what you're sending to Jeff Dixon Ross?
I'm going to respond for him and say he will.
Thank you.
even if he forgets, we'll make sure Christy Snow gets it.
So. Okay, thank you.
Yep.
All right. So I completed the ad of the person because I didn't want Benefits 24/7 to time out. So completed, I submitted my new subscriber, and now I searched for them again in my same organization. Now I'm going to manage that subscriber. And here is where we are on the subscriber dashboard. Now we're looking at the subscriber dashboard as the benefits administrator. So if I was logged in as the actual subscriber right now, this is what I would see. I would only have these two tiles on my page, profile and current coverage. And that's because one of the things that we took from My Account and made better, I like to say we made it better, is that we do not give all of the rest of the things, manage dependents, submit an SOE. We don't give those tiles on their dashboard until they actually go in and complete their newly eligible. And so really focusing them into completing the most important task, which is walk through newly eligible, and then we'll give you all of those different abilities on your dashboard. So before I jump into the wizard, as we like to call it, the newly eligible option here, I do want to point out, since we are in here as HCA, the benefit admins as well, when they're managing their subscriber, they will have the ability to see all of the tabs here when they're managing their subscriber. So if we select the eligibility tab, we go right back to that page. In My Account, I remember this. We just did a presentation a week or so ago, and I couldn't remember the name of this page in My Account. It's the employment page. It is eligibility. So this is where we would go in to terminate somebody, etc. We're going to walk through that after we've actually gone through and added somebody. But we have the eligibility page, we have managed dependents, profile, etc., etc. One thing to highlight, there is the notes page. So I talked about account corrections is not in Benefits 24/7. So we moved the notes page to the actual managed subscriber here. And just like we would do in the 58 screens and pay one, when you're helping or assisting on an account, making sure that we add the notes here on this page, very, very important, so that that we're able to keep track of things that have happened on that account. So I'm going to go back to the dashboard here. Yep.
Hey, just to clarify, so that I don't believe the BAs will have access to that notes tile. Is that correct?
Pretty certain.
Okay.
That they won't.
Yeah. Two questions. Would they be able to edit it or see it? I have a feeling I haven't seen it before, so I'm just curious. Just want to confirm.
Yeah, I will double check on that and
Okay.
make sure I have an answer before our second part of training. Let me make that note for myself. Okay,
I got it. I got it at 2. So
thank you. All right, so I'm going to go into the newly eligible wizard, and this is where I just wanted to highlight. It is much of the same process, but a little bit more friendly, I like to say, than Sub My Account. So we are going to walk through adding dependents. We're going to walk through this whole process. So it might be a little bit cumbersome as we add in all of the dependents here, but I want to make sure that we see this whole process. So let's add in a spouse. And then, of course, again, any field that has an asterisk is required. So we're going to select our relation here. Because I selected spouse, it is going to require me to put in my partnership start date. And we'll say 2010. This is my married spouse. So we have to also select the qualify reason. And then our SSN here. And then if the dependent was to have a different address, we have that ability to include that here. In this case, the address is the same. So now it's saying, let's go ahead and move on. Let's add coverage for your dependent. So here we're going to ask them upfront, what benefits would you like to enroll the dependent in? So we're going to just go ahead and say both, and we'll highlight. If you don't select medical, it just says go ahead and proceed to the dependent review. If you do select medical, it's going to ask you to require to make your tobacco attestation. And that's because we know the tobacco attestation doesn't apply if you're not enrolled in medical. So we don't force them to answer the question if they're not actually enrolling in medical coverage. So yes or no option here. I'm going to say no. Now it's asking me to continue to the spousal surcharge. And since I said yes for enrolling the spouse, the first question is automatically checked as yes. And then as we continue to select yeses, more and more questions will appear. I'm just going to go ahead and for funsies, say no to question 4. And I won't even have the ability to change the final question to yes, because it does not apply if I've answered no to any question before question 6. So select next, and then it's going to give me the information. You're not going to pay that surcharge. So we're going to go ahead and proceed to dependent review here. It's going to tell me here's who you added, what coverages you enrolled them in, and if the surcharges apply. And I'm going to go ahead and hit save. And then it says you have successfully added your dependent. Do you have any additional dependents to add? And I do want to add one more just to show you guys. Again, should feel familiar here. So I'm going to add a disabled dependent, but I want to show you how. I had to think about the dates really hard, sorry. So 2001, I select a child. I don't have the ability to change the qualify reason. So even though I know I'm adding a disabled dependent, the qualify reason when the relation is a child is driven based off of this date field. So the second I change this to a date that's at least 26 years or older, if the relation is a child, we now have the disabled dependent qualify reason automatically selected because they are over the age of 26. And once that disabled dependent qualify reason is selected, we now have additional information that populates below. It links them out to the certification document, provides additional language here to encourage them to submit the certification in addition to their dependent verification. So that does also happen in SMA, but I think the biggest thing that is different for Benefits 24/7 is that we're providing a lot more additional language for them as soon as we have that qualify reason as a disabled. Same for extended. If it was an extended dependent, we are also going to get the language linking them to the certification form. So, all right. And then the rest of this is exactly the same as what we just went through with the spouse. So I will move through this quickly.
Sorry, Amanda, can I ask another question?
Of course.
So you just check boxes for medical and dental. I'm back to the medical only groups. Will they see both options?
No.
Okay, thank you.
Yep. All right, I am not going to add any additional dependents at this time. I think you all are.
Or Amanda, not Amy, sorry. You have a hand up, is all I was going to say.
Oh,
and it's down now. Never mind.
It's me. It's Amy. I just have a quick question. In the Step My account currently, it says when they gives them the direction to fill out the disabled dependent form, it says do not upload to Step My account. Is that language that we should include here as well? Next
I was just
that?
about, you were just about to see that.
Oh,
no,
okay.
You're leading me into my next section. That's
Oh,
perfect.
Sorry about that.
No, no worries. That means that you're thinking, and that's exactly how this wizard is working. It's working along your thought process. So I love that. That was perfect. So I'm going to say no more dependents, and we're going to go next. So it's just going to give me a review here of the dependents I've added, what coverages I've stated that I want to enroll them in. Now it's telling me, hey, you need to provide proof for these dependents, right? And let's go to upload that proof. So right here is exactly that message you asked about, Amy. Certification for a dependent with a disability should not be uploaded here. Please follow the instructions on the form. So this message that's highlighted here in red does not display if there's not a disabled dependent on the account. This message only displays when there's a disabled dependent added to the account. So again, to discourage them from uploading that form. The rest of this should look and feel familiar. We're going to upload a document, so we'll select a file here. Let me toss one in. Give me a quick moment. So I've uploaded a tax return here. Down here, it says what my document is. Now I'm going to select what is that document type. It is a tax return. I am going to apply it to both of my dependents here. And once I've selected at least one, upload and confirm. And then messaging, I'm going to proceed to elect. Now it's going to walk me through coverage. So medical plan. The one thing to note, as HCA, we do see a button up here that says see all plans. And I know this is really applicable for PEB because PEB is based off of where you live, right? I always get it confused. So it's based off where you live, but there are some exceptions. No, based on where you work. I don't remember. You guys know. But there are exceptions to the rule
plans.
for PEP.
Most of the plans are live or work, not all of them.
Right. But for PEP, there are exceptions, right? Where you could enroll in a plan that's not available to you. And for us, we've had to do a manual override to allow them to enroll in that plan, correct? In Pay One?
Correct, actually.
Yeah, that's what I was thinking.
Outside, yeah, outside the county of their residence, we usually had to override it with a double edit. Yeah.
Yeah, and I think that's applicable for, like DSHS that has a lot of different locations. There may be plans available to them that aren't necessarily available to other folks. I can't remember the exact scenario off the top of my head, but what I did want to point out is I am in Thurston County with this person, so we're going to see almost every single plan. However, as HCA, if we needed to enroll somebody in a plan that wasn't necessarily available to them based on the information that's been provided, we can select See All Plans. Benefit admins do not have this, but we do as HCA staff. We can select See All Plans, and then if we need to enroll somebody in a plan that is different than what's available to them, we now have that ability. So, for example, you can see the Kaiser Northwest plans are available here. If I unselect it, they're not there. So gives us that quote unquote override ability. And
so currently, in Pay One, the employers can do the override. So they're going to have to be told that they can't do that override any longer. So Pay One, they can hit F10 twice and override to enroll somebody in a plan.
Okay. Well, we'll have to take that note.
Because that's going to be a big change for them. I just wanted to point that out.
Okay.
All right. I was just thinking because that will be a ticket to us.
Yes, or a phone call.
Right. Okay.
All right. We have our waive checkbox at the bottom. If they're not going to enroll in medical, go ahead and select a plan. Again, another message here for our child with a disability, making sure you certify them with the provider. So yet again, another opportunity for messaging here.
Do we get the same kind of messages for extendeds?
There is messaging when we add the extended. I don't think that this message would apply for like when we select a plan. This is really because, and it's really big in open enrollment, I know is where we got communication from Carla and Tanya at various points is that, and Kelsey as well, when she was in the disabled program, that when folks changed their medical plan during open enrollment, they didn't necessarily realize that they needed to recertify with their new carriers.
Well, I just wondered in general if there, yeah, not specifically
extended.
that one. I just was wondering if there was any prompts that they have to, the extendeds also have to submit a certification form along with their enrollment.
Yes. Yep. When they're added in, they get the notification, and I believe as well on the upload page.
Okay. Thank you.
Great.
So I have a question. So now it's going to be telling them to submit for recertification only in extended dependent form. However, what I'm running into is that the court order is often already purged in my account. So in fact, they also have to submit new legal documents because we can no longer view them, in my account.
So you're talking when extended dependent was on and then came off and is being put back on? Is that what you're talking about?
Just the recertification. You know, if they by the time a recertification comes up, that initial court order is already purged in my account. So yeah.
Well,
so
they're supposed to. Aren't they supposed to be providing the court document every time they recert? I thought that was part of the process.
Yeah, I have an extended dependent and I wish I didn't have to. I just resubmit the same document each time, but yes, that is the case.
I don't know if it says that in the letter. I saw it always only says, does it now? Okay, okay.
It
Used to
says
say
it in
just
the
a form.
The
It does
the
now?
form
Okay.
itself, yes.
Oh, the form itself now. Good. So that's a change. Okay, cool. Thank you.
All right. We did make this small note. This is also in my account now as well, but this was a big ask, I believe about a year ago, to provide messaging when somebody selects Delta Care versus Uniform, because it's confusing with the Delta Dental. And then once we've made our plan selections, again, we're showing them big lessons learned from My Account, right? We're giving them lots of opportunities to see, here's the plans you selected, here's the people you've selected to enroll. So yet again, this is also where they would see their plan messaging. So we're going to go ahead and confirm. Now it's going to ask about subscriber tobacco use. Yes or no, legal notice, confirm. I went through that quickly. Not really any change to how the tobacco operates. So let's talk about the supplemental. So the supplemental page starts out with the long-term disability. And so we talked about how for PEB, adding a PEB subscriber, that salary was required. You guys are well familiar with this because we do need it in order to calculate the LTD premiums. Here we're actually showing them on screen when they're selecting their LTD. We're going to give them a here is based on the salary that you're currently getting, based on what your benefit admin has put into the system. Here's what your potential monthly premiums would be and the benefit that it would provide if you needed to submit a claim.
On that benefit, that amount that they would get, so that is subject to other things like Social Security and things like that. So they may not actually get that amount from the standard. Can we put that as a potential monthly benefit?
Or up to.
Or up to? Something that indicates that, because if I see that and then I go out, but I'm also getting money from other sources because of whatever happened to me, standard reduces your benefit based on that, so it never exceeds that. So I think we need to indicate that that may not be the exact amount I'm going to get from the standard every month.
Okay. I'm taking notes, Amy, so I just want to confirm that your request is to add the word, is it simply just to add the word potential before monthly benefit amount?
Or up to something that qualifies it, that I may not estimate it, that I may not get that exact amount, because I don't want phone calls back to us because they saw in there they were going to get $3,000 and now they're getting 2,000 because they're getting money from other sources.
Can I pipe in? I know that I'm working through the language review now, and I just went through the step one, and that's a correction. So the verbiage is you are automatically enrolled in a plan that covers up to. So that verbiage, yeah. I'll double check it's on the PEB side, but definitely I know that's on the sub side.
Great,
well,
thank you.
It says that up to where it says employee pay LTD at the top of the page. It has that up to 60%, but it,
yep. Okay.
That's buried though. Yeah, I'll take it a note, and then Brandy, if you can let me know during stand up tomorrow, that'd be great.
Sounds good.
If that, yeah, thanks.
Sorry, you cut out. What did you say, Jeff?
No, it's
Sorry.
okay. Well, we could talk about it tomorrow. Yep. All right. So they can select 60, 50, or decline. And then there's, of course, the just language and links to the other various benefits, life and AD&D, link for beneficiaries in there, which I know has been big. And then of course, FSA decap in a bunch of language, a link to health savings, smart health, auto enrollment.
Do I remember correctly that the employer groups will not see the FSA decap option? Because they're not eligible for it.
I know we have restrictions on this page for various things, but we can double check on that one.
Thank you.
Yep. All right, I'm going to hit continue and review. Okay, so summary of coverage elections. As we're very familiar in My account, once you have done all of these things and you hit confirm, you just see a page and it says, congrats, you're done. Download your summary of coverage. So here we have put it on screen for you, and you actually have to look at this and acknowledge it, and you get to see all of this stuff right up front. So we see each of our people who we've added, when their coverage is effective, the premiums, the surcharge, etc. I'm going to hit next. And then we see that second page where it has the life insurance and the long-term disability coverage. And hit next again. Our fund legal notice here, scroll through, confirm, and then now it says you're all done. So we just provide that opportunity right for them on screen. So that they have to see it and acknowledge it before they submit. And of course, at any time, there's always the opportunities to go back in, make changes, etc. The download ability is still here. And so now I want to show you, once we have completed, I'm going to hit back to my dashboard. And here now you can see for the subscriber, all of the other tiles are now available. So for the subscriber, special open enrollment and account changes, managed dependents, supplemental coverage, retiree, and continuation coverage. So now that we completed our newly eligible, we have the abilities to go in and do the rest of the, see the rest of the pages. So I wanted to spend a little bit of time going through that just because it is very similar, but it also is different. So any questions that people haven't asked yet that they would like to ask now?
I have a few questions.
Of course, what's going on? Happy to help.
So hopefully I remember them. The first one I'm going to ask, if I'm a BA and I'm keying the elections for my employee, is the suggestion that they go through the wizard as well, or can a BA do enrollment by not using the wizard?
They have to use the wizard.
They have to use the wizard. Okay. Yep. And then that wizard should remain available to the lower limit for the BA.
Correct.
Correct. But it would not remain there for the employee after
Correct.
the 31 days.
Yep.
Okay. Thank you. Great answers.
Yeah.
By the way. The next one, if somebody, it probably more likely would be the employee. Let's say the employee gets through the part of adding the dependent and then has to leave or check out or doesn't finish the enrollment. What do they have to complete it or start over? Or is I didn't necessarily recall save buttons or anything. I'm just curious what has to happen there. And let's say I'm halfway through it and then I come back in the next day as an employee. Am I going to see all the text box on this screen, or is it still going to know that I haven't really finished yet?
Okay, let me take that step by step.
Sure.
So if you start, let's say you go through and you add a dependent.
Right.
And then somebody calls emergency, right. You have to step away from your computer. Right. But you've
or I get logged out to the timing.
Or you get logged out. Right. Yeah. Anything like that comes up. And you've saved that first dependent, that dependent's in there, right? You've gone through the point of adding their demographics. You selected the check boxes for what coverage, you completed any applicable surcharges, and you've reviewed and you've saved. And if you get to this screen where it says you've successfully added XYZ. Do you have anybody else? Once that dependent's been saved, so that final save button, then they're in there. They're not going to go away. If I think, if I remember correctly, if you were to leave prior to that saving of that dependent, the dependent won't be saved, and then you'd come back in and have to re-add them. But basically, each of those pages are kind of a checkpoint. So the dependents, the document upload. So if you go through kind of the saving of each of those sections, then the information has been saved. Of course, if you go all the way through and then you go back in tomorrow and you want to change your plans, all of that information will have been saved and you can just kind of step through. But your final question was?
I forgot, but I'll ask this one. So if
I was hoping you'd fill me in.
If they didn't complete it, so let's say I got through the dependents, but I didn't make elections or whatever.
Yep.
So I come back the next day. I'm assuming they should click back on the wizard.
Yep.
Do we know, will it start them at the beginning and have the data there, or will it already know where they left off and start them at that point?
It's not going to start them where they left off. It will start them back at the beginning, but
they would just walk through and say, oh, I've already got information there, and then just click next or whatever to get to the next.
You added 3 dependents already. You didn't get to the point of plans. You come back in the next day. It will say, do you have any additional dependents to add to your account? You would say no, and then it will move you on to the next
and then
page.
Move forward. Okay.
Yeah.
Thank you. If I remember the other thing, if there was another thing, I'll bring it up. Thank you.
Okay, no problem. Any other questions? How about instead of me asking if you guys have questions, is this seeming, anybody feel like saying if this feels radically different? Are they feeling a little bit of relief seeing that it's very similar? Thoughts? Putting people on the spot.
Well, of course, on the SEB side, I think it's familiar, right?
Yeah.
But the PEB side, it's going to be a whole ball game. But it's the same information, right? I mean, we're still asking. It's just a different format. So from that perspective, like the data still request is the same, just the tool is different. Versus in the SEB side, I think it's, at least to me, it looks pretty similar.
Yeah, and that's the big thing to highlight is, yes, this is very different for PEB, but the format is very, very similar to how SEB My Account is. So the actual actions of using benefits 24/7 hopefully should just feel familiar from our perspective. I know for benefits administrators and PEB this is very different, but from our end, hoping that this feels familiar. All right. Since we have a quiet bunch, I'm going to jump into, let's see. Okay. Since I uploaded documentation for this person, I am going to go back here to my admin dashboard. I am going to pop over to dependent verification. Again, this should all feel very familiar. I am going to expand my spouse here. We can see our document that was uploaded. In this case, it's a tax return. And we can go ahead and verify, complete our verification here. Verified, the date is auto-populated to today, of course, the document type that was used, and submit our changes. So here with the disabled dependent, and this will also apply to an extended. So I do want to make sure that we're thinking about it from both perspectives. Of course, we know that we need to complete not only the dependent verification, but there's also the certification aspect. So the dependent verification portion is available for the benefit admins. right? The benefit admins can verify the dependent relationship. Obviously, they cannot do the certification portion. So the dependent does display in the dependent verification section. However, I do want to point out, and I'm going to go back to my HCA dashboard here. And I really want to make a point of acknowledging this because I think we have an opportunity collectively to utilize this system in a manner that maybe wasn't well working in my account. So the HCA dashboard has the dependent verification section. And this is really for any disabled or extended dependents. I believe it also has the non-Washington state domestic partners. I'd have to double check on that. There's a bunch of people in here because I know many folks are playing with the system in their training. But this section it's not going to have spouses or children because those can just be verified by the benefits administrator. So I'm going to go to my dependent that I added. And I'm going to go ahead and verify them. And I also want to walk through the certification piece again, because like I mentioned, it's the same for extended as well. So I'm going to go ahead and submit my changes here. And now we can see the status has changed to, or it shows pending certification. So they were verified, but it does still have pending certification. So I'm going to open this back up. And now I'm going to go to the certification piece. And so this is very, very similar to Set My Account, adding the certification. You find them in the same queue, the dependent verification queue for HCA. And we can add the certification type. We'll call this one a temporary. Let's say this one starts 4/1/2023 and it ends. Nope, we're going to say 12/31/2023. And I'm going to hit save. So I've added my certification here. And then we also can come in here and update the status. And what this does is this status will actually display for the subscriber. So if the subscriber logs back in and they see that their extended or disabled dependent hasn't yet been certified, they would see that their status is in pending. So we want to make sure that we come in and update this and we can let them know additional documentation's needed, requests for more information, or we can put in here that this has been approved. We see the certification start and end date. So again, the subscriber can see this when they go to their dependent page and be able to actually see the certification information. And we'll just say this was reviewed today. So this is a little bit of a new functionality. Go ahead.
Yeah, this is Carla. When you get to a stopping point, I have a question for you.
Okay, let me just hit submit here and then yes, go ahead.
Okay, back on the prior screen on the certify tab, you said it could be used for extended or disabled. So how can I tell what I'm certifying? If I'm certifying the overage dependent as a disabled dependent or as an extended, and what if they're both?
So you see here in the reason, you can actually see down here, there's two extended dependents, right? And so we show that in the relationship type qualify reason, we see that it's an extended dependent. So that's how we can tell the difference. The actual certification piece isn't any different because it's either a temporary, well, I think the extendeds only have temporary, versus the disabled have temporary and permanent. So that is one of the ways you would see that via the relationship type. And then of course, you can only do a temporary for extended. If they are both, and I know we've talked about this kind of at many different functions, many different times. Yeah, we have the ability to capture that it's extended and disabled, but very similar to pay one, we can really only keep the one certification. And so if it's and that goes back to more of like the rules on how you guys keep track of the certifications, but within the system, we would only keep track of the one certification.
And we don't keep track of certifications in the disabled dependent program. It's not like we keep a separate spreadsheet or anything. It's all based on like running reports in pay one, for example.
Okay.
So we can talk about this later, but probably need Amy's team's help too to sort this out. Because if we certify our disabled dependent, then they won't be able to work on the extended. It seems like to me. And then the other question I have, once we perform the certification, in the status tab, will it automatically update to approved, or do we all the time have to go into that second tab and update it?
It's a great question, Carla.
Can you make it automatic?
Yeah, of course we can.
With enough time and money.
Yes. How did you know? Yeah, actually, Jeff Grubner and I were just talking about that this morning because I said the same thing, and right now it does not, as I like to say, automatically change the status to approved. So we do have that captured already, and we will be prioritizing that. And as soon as we have that function fixed, we will make sure that we let everybody know it's been updated. But by the time we go live, that is likely not to be automatically happening.
Okay, can you show me the drop down in the status tab of, you said it was pending, approved, or like needs more information? I was just curious what the drop down looked like.
Here. So we have approved, expired, not approved, pending, pending additional medical documentation, pending communication from subscriber, pending request for more information.
So FYI, that information is not displaying for us. All we're seeing is the pending.
That is.
I was
gonna
question
mention that
myself
earlier, but I just thought you were going fast through it and you didn't see it.
I forgot about that, and I don't know why that happened.
Amanda, you should be used to that. That happens every time we meet.
Alyssa, why didn't you remind me? Alyssa's always like, I don't see what you're showing me. And I'm like, dang it. I don't know why that happened. So I read them off. Did that help?
Yes, that helped.
Okay.
I do worry about that a lot, having that. I don't know the benefit of it.
Okay.
And I'm afraid it's going to cause more questions, because sometimes it might take us like 3 days to sort something out, but it's not that we need to update the status, and maybe we'll just leave it as pending until we approve it and not worry about the rest, I guess.
Yeah. And we can always reduce those options too for the status if it just makes sense for pending, approved, expired. Those 3 seem to make the most sense to me, but we can definitely talk through that when we get to the point that we can work this auto magic function.
Yeah, because if they're denied, we
denied.
We don't usually update anything. There's nothing that we currently keep or a denied disabled dependent. So yeah, maybe we can talk through that more.
Absolutely. Will do. Okay.
Carla, just an FYI, you were talking about the dual extended disabled dependents. My staff don't do those. Alexi Huffington does those in pay one. So I don't know what that process is. I don't know what that process is if they're a dual extended disabled, because Alexi has always handled it.
I thought you did everything.
Yeah, Amy.
Oh, please. I have enough. I can't do everything. I don't know all the answers. I'm just saying.
Oh my goodness. Okay, any other questions on this portion, the certifications, where to find them, how to update them?
So on the extended dependence, when you have the certification screen,
yep.
I don't know if that's what you talked about with Carla or not. If I missed something, I'm sorry. Why would you have it in pending and put in the certification dates? Wouldn't you just want to put in the certification start and end dates once you approve it?
Yes, the status portion that I'm showing right now is an opportunity for PERS pay, so benefit admins and subscribers to be able to see. So that was something that we added in as kind of an enhancement from SMA, because we know people sometimes get, rightfully so, antsy about finding out about if things have been approved or not, because sometimes mail gets lost or it takes a long time. So the status was added. Like I mentioned, we are going to have a conversation down the road about this status and see if we want to continue, if it's helpful, if it's not helpful. But that is what it was designed for, individuals to see where things are at with their certification.
Oh, okay, because I thought I've seen where it said a certification start date and certification end date, but the status was still showing in pending. Maybe I just missed something. That's what confused me. Like, why would you have the dates there and still have it in pending? Okay.
Because it's not automagic, she said.
Yeah, the status is
Well,
not automatic.
why not?
I know.
Thank you.
You're welcome. Any other questions on this section? All right. Okay. Let's see. Next on my list was, I am going to go back into my, I got to think about my social security number here. I'm going to go back into my subscriber, and I just searched them from the main managed subscribers page. If you have enough information, if you want to search that way, or you can go directly through the organization and search. It's really a matter of preference. If you go through the managed subscribers and let's say you put a last 4 of a social, because this does allow you to search first name, last 4 of a social, or the full social, just like SMA. But if you do that in the main subscriber search, and let's say you do a last 4 of a social, you might get a long list. Instead of going through an organization and searching, you'll probably get a shorter list. Just having all of PEB and SEB, something to keep in mind as you're searching for folks. All right, so kind of basic, but I do want to touch upon if we need to do things like updating dependent information. Let's say we needed to update a social. We can go to the managed dependents. Very similar. I just, want to make sure I'm calling out all of these little functions and different tasks that we might come across in our daily work. So if we got notified by a benefits administrator for some reason and they didn't update it, or a carrier, and we needed to go in and update a social, we can come into the managed dependents and we can update that social. Say we also needed to update a birthday, do that, submit our changes. So just wanted to highlight that little thing. And while I'm thinking about it, let me, I was going to put this in the chat for everybody. So one of the things that we did, and for those of you who were part of user acceptance testing, you've already seen this, but we did create a user manual. And so I just put that in the chat for you guys. We will continue to update that along the way as functionality has changed. New features come available in Benefits 24/7. We will update that user manual. Just understand that that's the user manual for us as HCA staff. So I know somebody, probably that wonderful Amy who does everything and knows everything, probably making a benefits administrator's user manual that will be very similar, but the user manual I just sent for everybody is the opportunity for us to walk through functionality and benefits 24/7. So helpful guide walks you through all of these things. It doesn't get into, all of the possible edge cases or anything like that, but really just walks through the main pieces of benefits 24/7. Which does lead me to, I want to address one thing before I continue on. Over the course of this week and next week, when you guys are in the 2 sessions, we're going to just be touching on the main functionality, really what's in that user manual, how to use benefits 24/7 for our PEB and SEB members. However, I know and recognize that not everything is super straightforward. We get phone calls from benefits administrators. You guys are used to crazy, wild things that come up, and how are we going to be able to do that? So while that's not necessarily going to be the focus of the training this week and next, we do have sessions that have been scheduled for questions. And I know we have their kind of check-in sessions twice a week, I think on Tuesdays and Thursdays or something of that nature, where folks can come bring questions about benefits 24/7, and we'll be available to answer those questions. Also in April, while I don't have a date or a time to give out today, I will host another session of opportunities to talk through and work through some of those more complicated issues or questions that you guys may deal with in your daily work, and try to work through how we could handle those. So the focus of this training is, how does benefits 24/7 work? What are the main functionality? But I do recognize that not everything is what we call a happy path. And so we'll be providing additional working sessions to talk through some of those things. So hopefully that helps help you guys understand the direction we're taking with training over this week and next. All right, so I know this isn't something we would normally do on just a regular old subscriber. Sorry, I'm getting my words confused. After, as an HCA person, if we go in and complete newly eligible for somebody, we don't necessarily always, make notes for something like that. But I'm going to go ahead and add a note just because I like to always document anytime I do anything. I think that's really been a standard for you guys in Pay 1. When we make changes to an account, that we notate it. And as we are moving away from doing all of our enrollments in Pay 1, and we're doing all of those enrollments and changes in benefits 24/7, it is very important to make sure that we make notes on the accounts in benefits 24/7. So I'm just going to say added subscriber and completed newly eligible based on, this is just my note. So all right, I'm going to go ahead and submit. And now we can see when it was created, who created it, and what they said. So just wanted to acknowledge that note section. Question I can anticipate, maybe one of you will ask is, are all of the notes from Pay 1 going to be migrated into here, and will we see them? And we are not taking all of those notes that are currently in Pay 1 and bringing them into Benefits 24/7. We will still have, you know, read-only access in Pay 1, so we'd still be able to get access to those notes. But anything that's already been notated in Pay 1 is not going to show up in Benefits 24/7. So it will really be notes going forward.
BAs cannot note accounts, correct?
I don't believe so. I don't think so. I don't know if Jeff can answer that off the top of his head.
Sorry, what was the question?
Can BAs note
make
the
a
account?
note? I don't think so.
Nope.
Okay.
Okay, good. Thanks.
Yeah. All right.
I believe they can read the notes though that are in the application. So they would be able to see that through the subscriber history screen.
All right, so staff, be careful what you write.
I have that, actually have that as a question that Amanda said she'd follow up on. Are you sure about that answer, Katrina, or do we still need to follow up?
So current functionality is those notes are visible to me as a benefit administrator. If there's a change that has been logged on that, I haven't seen it.
Well, I think
I know
that
I can see them if I log in as a benefit admin right now.
Is that an issue? I know that in the past they had to put in a public request for information to read our working notes in Pay 1.
So that would be a business call. If you want to suppress the notes, then we would need to, if we don't already have a work item to change the functionality, then we could do that. Otherwise, any notes currently that are entered would be visible to a benefit administrator. And I would want to double check with Jason, because I did think that when we did the mapping exercise for Pay 1 that we were going to pull the notes in, but if not, then I'm wrong on that.
Yeah, this is Jesse. We may want to look a little bit more at that, because I think it's entirely possible that our notes could pertain to the benefits administrator. We work as partners, but a lot of times we are in the business of resolving errors at the employer level. And sometimes those account notes would reflect disagreements with the employer. I don't think we'd want to just blindly say, yeah, they can have carte blanche access to everything we see.
Also, if you might want to check with public disclosure, because if it is a public disclosure request currently, then it probably should remain. It was probably made one for a reason.
I think I want to clarify what I had asked earlier was in specific reference to the notes tile, right? Hey, is that tile going to be there for a BA to see or edit? And that's, I think, that the note you took down, Jessica. And I think I heard Katrina's responses. I don't know that that note tile will be there, but notes may show up in the subscriber history field. And then I'd be curious to see what that.
The note tile itself is not visible to benefit administrators, but currently the notes entered into that tile by HCA are visible on the subscriber history enrollment screen.
All right, so I think that's the little distinction there.
And let's just go look at that since we're talking about it, as I think that helps. So there,
when you think about the ServiceNow tickets that we have, you can have notes that are working notes that are visible to others and some that aren't. I don't know if that could be modeled after that function.
Definitely something I know Jessica just captured and we will take back. All right, so I'm going to open up the subscriber enrollment history since we were just talking about that. So look and feel of this page is very familiar to all of the other search pages. So I am going to search for my subscriber here. Typed in my social and hit search. So here's the person I'm looking for that I want to look at their history. So I select the checkbox, and automatically down below, it's going to show me, it does take a little minute here. It's going to show me all the different sections here. So subscriber eligibility, enrollment, special open enrollments, etc. So those of you that have seen the audit report for SEB, it should look and feel very familiar. So if we expand the eligibility, here we can say what we see, what agency they were with, what their eligibility effective date is, eligibility type, reason, when that was created. So today at 1:30, who created it? If the eligibility was modified in any capacity, we would see a modified date. So we'd see a new record if it was modified and who it was modified by. So this really gives us an insight into, I know this is probably not fully connected. I'm wondering why this isn't displaying the enrollments here. But basically, all of these sections would display information. And then, as you guys were talking about, HCA administrative notes. So this is what would be available for the benefit admin to see unless and until we make that change to suppress it, as Katrina mentioned. So I don't know why some of these fields are not displaying right now. It's a little funky, but there then is also the ability to download this report. So I know that's been important for our appeals team. They use that quite a bit. Legal department, sorry. So hopefully next time we meet, maybe I can have a better opportunity to show you. I will have to check in on that. I'm not sure why that's not displaying very well.
Amanda, I have a
Yes.
question.
Yeah.
Okay, so up there under the subscriber eligibility. So when I was going over this screen with Jeff Dixon Ross, my supervisor, I looked at all these things because, you know, I've been putting a lot of people into the system, and I wanted to look at like what will this screen tell me? So when I was looking at that one under eligibility, so you have like, here's the agency is Department of Commerce, here was their eligibility date, but it has the eligibility type Y and reason. So for me, I don't work in pay one. I think those codes look like pay one things. So if I'm looking at that as a BA that gets hired April 1 and I'm working in this system and I've never ever used pay one, what does that stuff tell me as a BA?
That is a very valid point. Yes, those are codes, eligibility type of Y and eligibility reason of 01 are familiar to folks who do key into pay one, absolutely. But I think we can definitely take that down to maybe see if we could display it a different way. Because that is
Right.
a good point, right? Moving forward, people who haven't keyed into pay one aren't necessarily going to understand codes versus information.
Right. They won't be keying Y or 01 anymore.
Right. Yep.
Right.
Kind of like in the a Z versus a W doesn't mean a whole lot because they've never had to key in a Z or a W into pay one. So great call out, Debbie.
I do have one more question, and I don't know if it's going to show up. Can you scroll down a little bit, Amanda? I want to look at other options for you to like look at. So like maybe where would I see like enrollment for like say LTD? What would that be under? Which one of those?
It would show up under enrollments if I wasn't getting this really annoying spinning wheel.
Oh, I
here.
see. Okay.
Yeah.
So it would show. Would it show, like, say I originally go ahead and default into the 60%, and then later I want to come in and do 50%. Will it show that kind of information, like specifically? Because for me, looking at this, I just got confused because I felt like it was more of an audit log, like people for IT people to like be able to go to see like when somebody went in there, what this meant, because I just couldn't read the stuff. I didn't even know what it really all meant. And I was in there doing a whole bunch of changes just to test it. And oh my goodness, I just couldn't read it. I couldn't track it for anything. So that
it is a lot. In calling it an audit log is exactly what we've called it for SEB, and it shows the actual history of any changes that are made to an account and by whom and at what time. And it is a way the main folks, at least on the SEB side up to this point, the main folks who have actually used that report are our legal team when they get appeals.
Yeah.
And then of course, you know, I'm certain our error correction folks use it quite a bit. We on the IT side also use it quite a bit when we're helping out the appeals team or other various things that come our way to make sense of what could have happened with somebody.
My team uses it as well.
Yeah.
We use it all the time.
Yeah, many of us are familiar with how long these can get, especially with folks who make a lot of changes, and do a lot of different things to their account. But I'm going to see if by the time we all meet again next week, if I can't find out why this is happening and try and get a better, a fuller picture on an account and really talk through how to understand it.
Okay, thank you. I mean, I could probably send you one too that I did a ton of changes. From my perspective, if I was a BA, I would like to just be able to understand it. If I'm not really going to be able to use it as a tool like that, when I'm training BAs, I just want to be able to say this is like really good data behind the scenes that a lot of our people at HCA use. And if you really ever need to be able to read it or figure out what's going on and you can't, they should probably reach out to us or the other statement, right? This is a great tool for BAs and here's how you can read it.
Yeah.
I still know which one.
So
yep, I think
Deborah,
that's a valid point.
Deborah, this is Amy. We have actually sent the screenshot of the history when we get a lot of pushback from the BAs. I actually have had BAs come and say, well, who made the change? And you look it up and it was them. And for me to write back and say, well, you did it. I don't do that. I said, here's the history. And then they can see their name there, that they were the ones that actually made that change. So some of the SEB BAs are already used to seeing this type of thing. So it won't be too big of a surprise for some of them, because we have had to use them to shut down what they're yelling at us for. Employees will come and say, well, I didn't make that change. Well, here's the history. There's their name. They made the change. And we've had to use it as proof.
And I think on the other side of that too, right, is it's making this available for the BAs gives them that ability when a subscriber comes to them and says, I didn't do that. I didn't ask for that. I didn't, or I did this and nothing happened. The benefits administrator themselves can go look at this and say, well, actually, you logged in on this day at this time, and we see that you did do it. It gives them that ability without having to call HCA to call all you guys and say, we don't know, can you help us? It saves us a phone call. It saves us 3 fuses, right? Because the back and forth. So, yeah, I will. Go ahead, Jesse.
Oh, sorry. I was going to say this is one of the identified issues in our process where, obviously the employers have to make eligibility and enrollment decisions for their employees, and so when there's information that or the claim is something they can't substantiate or refute based off of systemic claims, benefits 24/7 was shut down the whole time for my whole enrollment. That type of claim they have to come to us for. I like the idea that they can now sort of find that information for themselves in here. It's just a matter of getting them to kind of understand what they're looking at. So
Amanda, I have one suggestion under the eligibility section.
Okay.
So I know people don't, and Seb definitely won't understand what an eligibility reason code is. Those codes all have a definition next to them. So if we could show the definition, because that would be really important, especially to those who use Pay One, to still be able to see that somebody's out on leave without pay, or it's somebody at a higher ed that's between periods of eligibility, or those sorts of things, because they're used to using those codes. So to be able to see that at least definition for those who don't use Pay One would be really helpful.
Yeah, absolutely. I think that's a great suggestion. So thank you for that.
Mm-hmm.
All right. With the remainder, I know we have about 19 minutes or so. I want to touch base on the access because I know many of us are familiar with provisioning access to benefits administrators. Sorry, just a minute. My dog is barking at, I'm guessing, some kind of delivery person driving by. So needed to shut my door. Okay. So many of us are familiar with provisioning access to benefits administrators in SEB My Account and what that might look like. And it is very much the same in Benefits 24/7. We can do it. The benefits administrators themselves can, if they have an admin access, they can add access to other individuals within their organization. And then, of course, we as HCA can also do it. So I want to look at doing it as HCA employees using this manage PERS Pay access page and try to ignore language. We did not do all of the language review update in the training environment yet. I know that there's still a few more things to work through. So on the manage access page, the reason it's going to be very important for us to use this as HCA staff is that we have a lesson learned from SMA is that we do provide messaging throughout the system. If somebody has already been added to an organization with an email address, that they can't be added to, what am I trying to say? We're restricting the ability for many different accesses. So how I can explain it is in SEB, we have ESD folks who may manage many different school districts. And if we go into the organization page and add them in the organization and give them access, it creates many different user lines, user access requests. I'm trying to not use a bunch of technical terms that aren't going to make sense, but it's not going to create many different records for the same email address. And it will actually say that this person already has been added with this email address into, I think it actually says to contact us, so that we provision the access to them under the same email address, and they can have access to multiple different organizations. So for those people who do manage more than one organization, they have access to all of those organizations from one login. They don't have to use many different logins, different email addresses, or anything like that. Our ESD folks are really ones that I know have this within SEB. So when we come in here and then we add a system user, I'm just going to do myself, because I don't think I have added myself in the training environment yet. So first name, last name, email, and then we hit save. And then we expand this record and we can do add access role. So what I'm going to do is I'm going to add one access, and then I'm going to show you guys how to add another access here. So I'm going to select my organization, and let's just say we'll go Bellevue College. The date assigned is automatically today. We can update that if needed. And we have the access levels. Admin, edit and read only. I believe we have, I think we have a bug out there, a bug that needs to be resolved so that one or more of these don't show. But admin, edit, and read only are the applicable access levels for benefits administrators. So I'm going to go ahead and hit save access here. Now, because I want to show you guys that message that I was talking about. So if I go to, I know this isn't a real life scenario, but let's pretend. If I go to add in a school district and I want to add a system user here, so this is adding a system user through an organization. If I type in same email address, and I'm going to put in the role and the start date. If I hit save, it gives me a message that a system user already exists with this email address. And that is, again, like I mentioned, to help get the person who's already in the system to add their access to the same provisioned login information so that they can manage multiple organizations with the same login. So in order to actually give them this access, we would go back to or if you got a phone call or a fuse, we would search for that person. I'm going to expand this record here, and now I'm going to say add access role. And here's where I could search for add in a school district. I could select the access level and the date assigned, and I hit save access. So then when I was to log in as a benefits administrator, now that I have Bellevue College and add in a school district assigned to me, when I actually log in as a benefits administrator, I have access to both of those at the same time. So a little bit of a change from ZebMy account, because I know that was for our folks who manage multiple organizations. It was a little bit of a headache. Did you have a question, Amy?
No, sorry.
Okay. No, no problem. Just wanted to make sure.
Hey, Amanda, isn't the email address added there? Isn't that what's also going to, doesn't that need to match the SAW
Absolutely.
account?
Yeah. Yep. For our SAW users, which is going to be all of the school districts, and then our non-state agencies that are on the state government network. Yes, they would. We have to make sure that it matches their email address.
Right.
For the benefits administrator.
So if they are managing more than one employer, they're going to have to choose the one address, the email address, because like this person would probably have an email address associated with Bellevue College and an email address with ADNA, but they would want to pick whichever one. I mean, it doesn't really matter, right, which one they use.
Right. And it's not the most common thing, right? It really is. Where I know it's applicable is those ESDs, where an ESD staff member themselves manages multiple, they're a benefits administrator for multiple, usually it's small school districts, right? So maybe I am at ESD 113 and I manage PL and Rainier and I don't know, those two are enough. I would want to make sure that the email address is my ESD address, and then I could have both of those provisioned under my ESD address.
This is also going to be applicable in PEB because of SACS, the small agency group that handles a lot of the tiny state agencies. So it will be used more than you think when we add PEB.
Perfect. All right. Any other questions? And then of course, removing if we've got notification that they're no longer part of an organization, again, we come in here and search for them, and it's as simple as selecting the remove, the date's auto-populated, we can change the date and save, and then they no longer have access to that organization.
Hey, Amanda, is the email address case sensitive when creating a SAW account?
It should not be. Don't believe so.
Okay.
Right. I am thinking this is a really good kind of put a pin in it point before we talk about more fun things like transfers and terminations and special open enrollments, all the fun stuff next week. So any other questions that I can try and answer now?
No other questions. This is Carla, but just wanted to thank your team. Amanda, I think you guys did a really nice job on this training, and you were able to take people's concerns and questions without being defensive, which is hard to do when you've worked so hard on something. So I really appreciate that.
Oh, absolutely. Thank you for that, Carla. All right. Well, I will hang around if anybody wants to stay and ask questions. I will see all of you again at our next session next week, where we'll get more in depth on some things. So thank you all. I really do appreciate all of your questions, and I'm more than happy to help you out. So have a wonderful day.
Thank you, Amanda.
Thanks, Amanda.
Everybody.
Thank you and good job.
Thank you.
Hey, Amanda.
Yes.
Do you plan to look to display dual enrollment next week?
I certainly can and will. Yes.
Okay, that would be great. Thank you. You did a
Welcome.
nice job. Appreciate it.
Thank you.
Okay, take care. Bye-bye.